If you are diagnosed with ovarian cancer, don't worry, there is help available. Watch this video to learn more about the diagnosis and treatment options. With the help of experts, you can make the best decision for your health. Keep watching this video till the end. Tests and procedure used to diagnose ovarian cancer. Pelvic exam. During a pelvic exam, your doctor inserts gloved fingers into your vagina and simultaneously presses a hand on your abdomen in order to feel palpate your pelvic organs. The doctor also visually examines your external genitalia, vagina, and cervix. Imaging tests. Tests such as ultrasound or CT scan of your abdomen and pelvis may help determine the size, shape, and structure of your ovaries. Blood tests might include organ function tests that can help determine your overall health. Your doctor might also test your blood for tumor markers that indicate ovarian cancer. For example, a cancer antigen CA125 test can detect a protein that's often found on the surface of ovarian cancer cells. These tests can tell your doctor whether you have cancer, but they may provide clues about your diagnosis and prognosis. Sometimes your doctor can't be certain of your diagnosis until you undergo surgery to remove an ovary and have it tested for signs of cancer. Genetic testing. Your doctor may recommend testing a sample of your blood to look for gene changes that increase the risk of ovarian cancer. Knowing you have an inherited change in your DNA helps your doctor make decisions about your treatment plan. You may wish to share the information with your blood relatives, such as your siblings and your children, since they also may have a risk of having those same gene changes. Once it's confirmed that you have ovarian cancer, your doctor uses information for your tests and procedures to assign your cancer a stage. The stages of ovarian cancer range from 1 to 4, which are often indicated with Roman numerals 1 to 4. The lowest stage indicates that the cancer is confined to the ovaries. By stage 4, the cancer has spread to distant areas of the body. Treatment of ovarian cancer usually involves a combination of surgery and chemotherapy. Other treatments may be used in certain situations. Surgery. Operations to remove ovarian cancer include surgery to remove one ovary. For early stage cancer that hasn't spread beyond one ovary, surgery may involve removing the affected ovary and its fallopian tube. This procedure may preserve your ability to have children. Surgery to remove both ovaries. If cancer is present in both of your ovaries, but there are no signs of additional cancer, your surgeon may remove both ovaries and both fallopian tubes. This procedure leaves your uterus intact, so you may still be able to become pregnant. Using your own frozen embryos or eggs, or with eggs from a donor. Surgery to remove both ovaries and the uterus. If your cancer is more extensive, or if you don't wish to preserve the ability to have children, your surgeon will remove the ovaries, the fallopian tubes, the uterus, nearby lymph nodes, and a fold of fatty abdominal tissue omentum. Surgery for advanced cancer. If your cancer is advanced, your doctor may recommend surgery to remove as much of the cancer as possible. Sometimes chemotherapy is given before or after surgery in this situation. Chemotherapy is a drug treatment that uses chemicals to kill fast-growing cells in the body, including cancer cells. Chemotherapy drugs can be injected into a vein or taken by mouth. Chemotherapy is often used after surgery to kill any cancer cells that might remain. It can also be used before surgery. In certain situations, chemotherapy drugs may be heated and infused into the abdomen during surgery, hyperthermic intraperitoneal chemotherapy. The drugs are left in place for a certain amount of time before they are drained. Then the operation is completed. Targeted drug treatments focus on specific weakness present within cancer cells. By attacking these weaknesses, targeted drug treatments can cause cancer cells to die. If you're considering targeted therapy for ovarian cancer, your doctor may test your cancer cells to determine which targeted therapy is most likely to have an effect on your cancer. Hormone therapy uses drugs to block the effects of the hormone estrogen on ovarian cancer cells. Some ovarian cancer cells use estrogen to help them grow, so blocking estrogen may help control the cancer. Hormone therapy might be a treatment option for some types of slow-aging ovarian cancers. It may also be an option if the cancer comes back after initial treatments. Immunotherapy uses the immune system to fight cancer. The body's disease-fighting immune system may not attack cancer cells because they produce proteins that help them hide from the immune system cells. Immunotherapy works by interfering with that process. Immunotherapy might be an option for treating ovarian cancer in certain situations. Supportive palliative care. It is specialized medical care that focuses on providing relief from pain and other symptoms of a serious illness. Palliative care specialists work with you, your family, and your doctors to provide an extra layer of support that complements your ongoing care. Palliative care can be used while undergoing other aggressive treatments such as surgery and chemotherapy. When palliative care is used along with all of the other appropriate treatments, people with cancer may feel better and live longer. Palliative care is provided by a team of doctors, nurses, and other specially trained professionals. Palliative care teams aim to improve the quality of life for people with cancer and their families. This form of care is offered alongside curative or other treatments you may be receiving. Thank you for watching my video. Subscribe to get regular updates on my channel.